We have the impression that the situation that you've described that has forced us to impose this curfew was something that could have been predicted and that was already predicted by the Scientific Council, who's already talking about pressure on these cities in July and August, who said that there would be a danger of this virus spreading faster once school started again. And then there was the failure of the testing policy. We waited for the tests for a long time in May, June, July, and so we don't understand how we could predict the situation before, how we could predict the need for all these tests, but not give ourselves the means to implement these tests in less than 2 days, because it was kind of wasted money.
You're absolutely right. We've encountered true difficulties in this area. We have to be frank about that and say it. Why did we have difficulties? Because we had the resources, and we pretty much kept in line with those resources. We're one of the countries now that does the most testing in Europe.
Not necessarily most efficiently, though.
We can come back to that. That's about testing techniques. We do between 1.2 and 1.4 million tests. And if I look over the last few days, I look at this every single day, clearly, and track this with the ministers. And I'd like to pay tribute to the work the government's done. The Prime Minister, the Minister of Health have been working night and day with their teams out there. We've had difficulties. There's been a great deal of demand, much more demand than we thought.
Because it was free. Because you didn't need a doctor's prescription.
Well, remember, our policy had to do with masks, and there was a question whether they should be free of charge. They were made free of charge for all children, school children who came from low-income families. It was millions of them, millions of masks. But not everybody got this free of charge. This became controversial. Do you think that the solution would have been to make the test
That's
pay
not
for?
what I think, but we should have had the resources to treat all these tests.
I accept completely that we made this test free of charge, because in France we decided there'd be no money obstacle. We've done this from the very beginning of the crisis. We're one of the countries that's given greatest economic and social support.
But because it was free, we could have anticipated this wave.
Maybe because it was free of charge, yes, but I don't think a lot of people just went overboard on this. No, it's mainly because people were worried because there was this virus that was circulating. It was circulating amongst people. We see this pretty much throughout Europe. So I wouldn't blame the testing policy for this. I would just say, and the report says this very well, yes, some of the lead times were too long. Why? Because we didn't have the requisite organization. I'd like to thank all the healthcare workers, public and private, that moved ahead quickly. But we didn't have a big testing center. We have a scattered network. We've got a system that's not accustomed to being put under such pressure. So people had to wait in lines to get tests and wait in line to get the results of the tests. These are technical considerations. You hear a lot about the PCR test. This is the analysis technique. What are we going to do? We're going to change things. And be forward-looking for the fellow citizens on this. For 6 weeks, there'll be a curfew in the major metropolitan areas and in Greater Paris. We're mobilizing throughout the country so that we can win this war. After that, gradually, we're going toward a strategy whereby throughout the country we'll be testing, alerting, and protecting. That'll be the cornerstone to our policy. We'll be ramping up in November, December. We're talking about living with the virus up until the summer of 2021 at the least. That's what the scientists tell us. So if we don't want to be ups and downs, starts and stops, we have to be better at tracking the virus. That's why I say we've got to manage to bring down the number of contaminations per day to 3,000 to 5,000 rather than 20,000 currently. So the first pillar is testing. We've got an innovation in recent days recognized by the WHO, the High Authority for Health. It's the antigen test. You'll still have to do the sampling in the nose or in the mouth with the swab. We know about this now. And then it takes 15 to 30 minutes, though, to get the results. It's faster. We can do this in pharmacies, other locations. So there'll be many other areas to be tested, not just test laboratories. This will be a major change. Next, we're developing techniques to analyze much faster and more tests at the same time. PCR method. We're also continuing innovation, not just in France, throughout the world, to move towards self-tests, so you can use saliva or possibly a pinprick, and you can test yourself. You have pregnancy tests that are similar. So we're going to move toward that strategy. It'll be rolled out in upcoming weeks. So we'll be able to further drastically reduce lead times to get results. If there's any hesitation, if you wonder, if you've got a contact or you've got any kind of doubt, you'll be able to get a test and a quick result. A second pillar. The second pillar is alert. If you've been tested and you've got to be able to alert, tell your contacts, people who may have been exposed to you. You may have had dinner with them and spent time with them, may have been at the canteen with them.